Good morning. It's a beautiful, crisp fall day. Welcome to the college's final virtual program in the 2020 celebration of Hispanic Latino Heritage Month. My name is Barbara Velasquez. In my role as coordinator of International Intercultural Education at Metropolitan Community College, we address historic and current topics daily, opening doors to challenging conversations and inviting our audiences to work together toward equal access for all community members. National Hispanic Heritage Month recognizes the contributions made and the important presence of Hispanic and Latino Americans in the United States. Today's panel will remind us that Hispanic and Latino populations have historically provided diverse labor that make living in the United States a more convenient and comfortable society for everyone. Just last night in our exploration of Mexican festivals in Omaha, we learned that the Barrientos brothers, perhaps the first Mexican trio in our city, labored in packing houses during the day. Your microphones are silenced during this presentation. Please send all your questions to Zoom's Q&A function at the bottom of your screen. Your continued attendance at International Intercultural Education programming could qualify you for recognition throughout the year. To be considered, complete the online evaluation and include your name and contact information. The online address will be on a slide at the end of the program, and it is mccneb.edu/IIEEVAL. Micky Devitt, Legal and Policy Coordinator for the Heartland Workers Center, will moderate today's panel entitled COVID-19 Clusters in Meatpacking, an Avoidable Crisis. Micky grew up in Colorado, where she earned her bachelor's degree in political science from the University of Northern Colorado and her law degree from the University of Denver. She worked for over 10 years as an attorney for the National Labor Relations Board in Washington, D.C. and Denver, Colorado, helping workers improve their lives through labor organizing and civil rights empowerment. She also enjoys knitting, bicycling, and discovering new places and experiences with her husband and 2 kids. Please welcome Micky Devitt, who will introduce the panelists.
Good morning, everyone. I'm so happy to see people here to talk about a really important issue. And I want to, before I introduce our panel of community activists and workers, I want to first give an overview of the problem that we saw in the meatpacking houses and continue to see, and what the community has come together to do about it. So our panelists have direct experience in both these actions and in the lived experience of families and workers in these plants. So I'm going to share, hopefully, let's see, okay. So I like to start because I'm a lawyer. I like to start with the sort of the law, the framework that this is all happening in. And so our federal workplace safety law is the Occupational Safety and Health Act, and it's enforced by OSHA, which I'm probably sure most of you have heard about. What I've shared here is the general duty clause. And so one thing that we saw happen in this crisis is that the Occupational Safety and Health Administration didn't pass a single enforceable regulation with regard to worker safety in workplaces. But there's still this general duty clause. Every employer who's under OSHA is required to provide a place of employment that is free from recognized hazards causing or likely to cause death or serious physical harm to the employees. And obviously COVID falls into this. At the same time, at the state level, we have what's called the Nebraska Meatpacker Bill of Rights. And this, I highlighted 2 of these: the right to a safe workplace, the right to complete information that includes information about your work, about safety, and importantly for it to be in a language that you speak and that you understand and that you're comfortable with. Now, sort of pulling back a little bit from that into how we decide what a safe workplace is, I like to use this little graphic because it's a very helpful view of what is happening and what happens typically in these situations. So this is called the hierarchy of controls. And in occupational safety, these things at the top that are in blue, where you try to get a hazard out of a workplace. And if you can't do that, you try to control it with the things that are the biggest structures, right? You try to engineer the building to have safe workspaces. You try to work with the administration to make sure you have safe training protocols and all kinds of things. And then at the very bottom, there's nothing more you can do. You give people at least the protective equipment like masks or things that keep them safe. Now, what's interesting about the controls is that, as you see, the most effective are at the top, least effective are at the bottom, but the most expensive are also at the top and the least expensive at the bottom. So what we typically happen, and what we saw happen throughout this crisis, is the most effective controls being ignored in favor of inexpensive PPE, if anything. So OSHA, although they didn't issue regulations, did issue joint guidance with the CDC that was recommended. One of the biggest problems in these meatpacking plants is that over the years, line speeds have increased so much that workers have had to get closer and closer together to keep up. And so you'll see in one of their first graphics in this guidance, everyone's crowded in there. That's a horrible situation for COVID, as we all know. And so what they recommended is reconfiguring workspaces, keeping people farther apart. This is the CDC and OSHA. And even if you spread them apart, making sure, if possible, that there are these barriers in the workplace. And you can see from this that good physical barriers are not just a little curtain or a sheet of plastic. They are tall enough that you can't look over them. They're long enough that you can't just peek back and talk to your neighbor, because the whole point is to keep you separated physically from your neighbor. And this doesn't replace distance. So other best practices that we saw in some of the plants, and I'll get to that a little bit, when we had unions and workers talking with us, was shift and break staggering so that people aren't clustering on breaks, ventilation and air filtration. The best case scenario is for air to get pulled out of the space. You want people to be screening when workers come in for any travel, for temperatures, symptoms, or possible exposure. We saw in some places we're doing increased sanitation in common spaces or high contact services, and best practices also require giving employees, really importantly, adequate leave to quarantine when they become sick, when they become exposed, or when they're waiting for a test. We saw some meatpacking plants offering extended leave for high-risk workers over 65 or with pre-existing conditions. But what I want to point out about all of these best practices is that when we talked with workers, when we talked with their unions, when we talked with the communities that we and our organizers work with, no plant was doing all of these things. And when they were, usually they were doing some of them after there was already sickness in the plant. They were trying to play catch up or do a few things or get masks to people after people were already falling sick. And so in contrast to some of these best practices, what we saw was this. So this, many of you have probably seen this. This is probably the most popular PR picture of COVID in the meatpacking plants. It's on half of the stories that we see in the news. And what we see here is, again, those little barriers are not, as you can see, what the CDC requires. You see someone in a nice clean mask. I can tell you that after a half a day on the line, the mask does not look like that. And you see, the protective clothing and gloves. That's a lot of that is actually for the general safety of working in these plants at all. But what we didn't see, so this all kind of looks pretty nice, and that's why they use this. But A, that's a best case scenario, and B, this is what was really happening. So when we talk to workers, when we talk to their unions, when we talk to their family members, we heard about them working elbow to elbow. The lines, instead of speeding up so people could space out, were actually speeding up in both poultry and pork production plants. the fans, instead of pulling dirty air out, were blowing down the work line. And in normal circumstances, this is like meant to cool down the workspace. But in fact, it's just, as you can imagine, spreading right down the work line. So when they leave the work floor, they're working in crowded, poorly ventilated locker rooms to change and take off all of those masks and all of those visors and everything else. They're crowded in there as they take off that equipment. The cafeterias were crowded, the halls were crowded. Masks, when they got them, we heard of workers having to pay for their own. We heard of them only getting one per shift, and in one case even, they were receiving hairnets to be used as face coverings. One of the biggest, though, administrative failures of this was some of these last ones. First, workers were being pressured to come to work sick or exposed. So instead of giving leave, they were actually pressuring them as more and more people got sick to come to work sick, come to work before they knew their test results, just to keep production up. And importantly, there was no transparency as to when someone was falling sick. So if you don't know your neighbor is out sick, you don't know to quarantine. You don't know how to protect your family. So that lockbox of information that you're entitled to for your working conditions, workers weren't being told, and the community wasn't being told when there were these outbreaks. So the results are both tragic, predictable, and now widely known. This is a map from the Food Environment Reporting Network of all of the outbreaks in the country. You can see actually the biggest outbreak in the country was just north of us in the Tyson plant in Sioux City, Iowa. And in Nebraska, you can see there were large outbreaks all over the state. And those outbreaks correspond still with the counties and areas with some of the biggest hotspots. Just to give sort of an overview kind of where we are with this, it's sort of skipped out of the public's consciousness, but and it seems like it's getting better, but really at this point, there have been 5,300 confirmed cases in the meatpacking, just among meatpacking workers. That's not their families or their communities. 23 deaths and 234 hospitalizations just in Nebraska. Now, to give you some perspective, that's about 1 in 8 of the total cases that we've had in the state of Nebraska has been a meatpacking worker, not counting their families and their communities. And here in Douglas County, so Hispanic and Latino citizens and residents are about 16% of the population. 33% of all illness tracked in Douglas County is still in that population. So Hispanic and Latino families here in Douglas County have been really hard hit. And still the hottest spot in Douglas County is zip code 68107, where the Heartland Workers Center is. It has 1,000 more cases than the next closest zip code. So that's just to kind of give you a view of kind of how bad it's gotten. But it's not the whole story, happily. I think the real story is what has happened as a result. Nebraska has had an unbelievable community and advocate response to this problem. So early on in about late March, Heartland Workers Center was contacted by Senator Vargas, who was hearing reports about all these issues from his constituents. We started to do some digging about the problem, but realized we weren't the only one. And so in coalition with about 25 other union advocates, community advocates, family members, community organizers from all over the state, we started a coalition of activists that took on this issue in multiple and really creative ways. So we saw press and interviews. We got people connected to actual workers who were living these experiences, who could cut through the PR noise that was happening from the plants that everything was fine. The Heartland Workers Center and others did a lot of work around worker education and public service announcements. We really tried to both inform workers about what their rights are in these plants and what should be happening, but also how to protect themselves. And since, again, I mentioned language, the right to information in a language that you speak and understand, we worked with community advocates to make sure that was all translated into the languages that workers needed. There were public rallies. There were really creative ones. There were drive-by, socially distanced rallies all over the state. The Children of Smithfield, one of our panelists, is one of the founding members of Children of Smithfield, really became engaged, and we saw the community really banding together around workers who were in many cases not able to come forward themselves. And another sort of community-oriented approach that we took was to directly work with the public health entities. So we tried to work with the University of Nebraska's, the Global Center for Health Security was creating COVID playbooks for these meatpacking plants. And so we worked with them to make sure that there were worker surveys and worker voices that were being heard about what was going on in the plants. Because they were being taken on tours of these plants by the employers who were giving them kind of the glossed up version of what was going on. And so we had them help them survey hundreds of actual workers to talk about what was going on in their world, and so that the playbook could reflect their real experience. In the policy advocacy sphere, we tried to use some of those rights that we talked about earlier, the state and federal agencies. So we helped workers file OSHA complaints, and to our immense frustration, they were summarily dismissed with phone calls. There were no on-site inspections, and to date, there have only been a handful of plants nationwide who've been fined for any violations of that general duty clause. So far, all of them have been a single violation. They boiled it all down to a single violation with a single very small fine. We also lobbied the Meatpacking Bill of Rights coordinator, who is responsible for enforcing that Meatpacking Bill of Rights that we talked about, and found that she had not conducted a single inspection either of a plant. And when we pressed the Department of Labor on this, we were told that their position was that it was too unsafe for their workers to go out to these plants to inspect them. And if that isn't an administrative failure, I don't know what is. Finally, we tried to work directly with the governor. We set up or participated in many meetings with the governor, both with workers and with community members, trying to talk to him about what was really going on. And he chose to defer to the meatpacking plants and how they wanted to handle it. So this all sort of came to a boil over the summer we were finally able to put together a meatpacking health and safety bill. So there's a couple of things that are interesting about this. One, so I want to point out as you can see, what we asked to be required of these employers was exactly what the CDC was recommending. We were trying to mirror what those best practices were and really put attention again on those higher controls, not just PPE, but those higher controls that really make the biggest difference. Another thing that I think is interesting about this is this bill was crafted with the help, again, of the community itself. We really worked to integrate the concerns that we were hearing directly from workers. This wasn't, workers knew what they needed. And when they spoke, they knew that what they needed was what the CDC was recommending. And so we worked to have workers incorporate their views of what was going on into this. And the last thing I want to just raise about this is that it was not a foregone conclusion. We were the only state in the country that was able to get a bill before their legislature on this issue. There were a couple of states that have state safety plans that they were able to get some help or some directives that way. We were the state to actually get this before our elected body. And that's in large part because we had such a strong coalition of advocates like the ones you're about to hear from. So today's panel, and I did want to mention, because of the work of advocates, those advocates, we were able, in advocating for this meatpacking health and safety bill, although it didn't proceed, when we had a hearing for it, there were 34 proponent testifiers from every walk of life. There were, the people you'd expect advocates and civil rights advocates and unions, but also workers and faith leaders and people from all over the state. So it really was a collective effort. We were able to have 59 letters sent in from people who couldn't come to testify, and 0 people opposed the bill in the hearing, and only 6 wrote letters. So I think this is a testament to the power of community. And so by closing, I just want to, before I introduce the panelists, just remind us that the strength in community is what we can carry forward. And this issue is far from over, so there's still a lot of time and opportunity to get involved.
Micky, this is Barbara. Before you introduce the panel, could I have you answer a couple questions?
Oh, certainly.
One is it okay to share your PowerPoint? We've got people requesting that, and I can set that up if you are okay with that.
Yeah, I think that's fine.
All right, number 2 is, have these mitigations reduced the rate of infection?
Well, so here's the issue. The mitigations, we were not able to pass the bill. So we ran out of time in the session. As we know, the session was delayed because of COVID. The amount of time that was left by the time we were able to get a bill to hearing was not enough to pass the bill. So there are still no, and I want to emphasize this, there are still no required safety protocols in these plants. This is a fight that we are continuing to fight. Where employers voluntarily employed these protocols, it has been better. There are some smaller plants that have done a much better job and have not had outbreaks. But the big industrial plants have not, where they have employed some, they do make a difference, but this is an ongoing issue and we still have nothing enforceable. So should I go ahead and, all right, I'll go ahead and introduce our panel. Oops. Okay, so Gabriela Pedroza was born in Guatemala and has been in the United States since 2000. She has an 8-year-old daughter. She's a graduate of North Valley High School in Reno, Nevada. And before joining the Heartland Workers Center, she worked for JBS Food Processing. Prior to that, she worked at Seaboard Foods in Oklahoma. She's been working with the Heartland Workers Center for about 6 years as one of our organizers. And her passion for workers' rights has grown after learning more about rights and about being part of a team that advocates for social justice. And she's certainly an important part of that team. Dulce Casteñeda is a daughter of a Smithfield Foods meatpacking worker in Crete. In April, after learning about the horrific working conditions that her parents were facing, she and other adult children of plant workers joined together to advocate for their essential parents. They called themselves the Children of Smithfield. She's going to share what inspired them to act in ways in which COVID has created further inequalities in meatpacking. And she's a former community assistance director for the city of Crete and is working as a legal assistant in a private law firm. Alana Schriver, after receiving her MPH with an emphasis in global health, worked as a community health promoter overseas before returning home to Nebraska to work in refugee resettlement. Over the years, she's provided direct guidance to resettled refugees as they navigate new American systems. She's on the board of 2 local nonprofits serving refugees and is an active member of the Omaha Refugee Task Force. She's excited to use her experience to expand these programs, and she enjoys gardening, beekeeping, and travel. So, having introduced them, I'm just going to invite Gabriela to share her experience, and we'll move forward from there. And then we'll take questions for the panel at the end.
Hey everyone, so as Micky said, thank you for that introduction. My name is Gabriela Pedroza. I work with Micky at Heartland Workers Center. I'm a community organizer there. I used to work at the 2 different meatpacking plants, one here in Omaha and the other in Guida, Oklahoma. First of all, I would like to just state that during the almost 8 years of working at meatpacking plants, I am very thankful for the opportunity of working there. It helped me and my family a lot financially. I learned a lot, but But now from that experience, I also know we have so many rights that I didn't know then. And I can also advocate from my own experience for better conditions. So my experience at the meatpacking plant was straight out of high school until 5 years ago, almost 6 years ago. And it's hard. It's hard work. As soon as you start working, you get a week of training and then you're thrown into the floor to start working. I worked in the cold side, which is called the fab. I worked on the speed lines and I worked on the scale. I worked with different types of knives, with the normal long ones, with the electric ones, and the circular ones. So it was very, very hard work to get done. The lines are fast. And as Micky said in her presentation, you are expected to trim a meat in a certain way, depending on what the customer wants, depending on how much fat they want on the meat or on the bone. So therefore you have to cut more, you have to spend more time with that product. And as the line is going, you do bump into your coworkers because then they have to do the next step. So it is a very fast moving work. And then a lot is very, very top down environment, is that you have to do the job correctly. Sometimes, most of the times, it feels the product comes first before the employee. The product is the priority, and most of the PPE, the personal protective equipment that you saw in that picture, mostly is to protect the product from you. So it's very hard. A lot of people have been working there for over 20 years, over 50 years. And at some point you do stop seeing yourself as a human being, just as a robot, because you go in there, you put on your equipment, and then you have to rush to the floor because you cannot be late. If you are late at least a minute, you already have backed up a product. And it's just, it's very, I guess, a very, very fast moving work. And it's very hard on your body. A lot of people have to work standing up. And when I used to work in the beef one, you have the cows hanging and you have to like trim around the bone. And it's that, just like, if once you hit the bone, your knife goes dull and you have to hurry up and make it sharp again before the next cow comes. And yeah, I had to work on that too. So it's very, I'm at loss for words right now, but it's very physically hard, mentally hard, because you just have to make sure that if your knife goes dull, which is not sharp, you're practically working with like a plastic knife, and you have to cut through that because you cannot let that pile up and you cannot do the product wrong, because then your coworkers that are on to the next step, they will have to pick up your work, and it's just harder for them. And so it's like, there was days where I was like, you get like a metal stick, then you have to like sharpen your knife. There was one time where I couldn't sharpen my knife for the life of me. I just couldn't. And it was just like all day, 8 hours, plastic knife. That's all I was working with. And I mean, it was bad, but yeah, we just have to push through. That's what we had to do. We just had to, we could ask for help, but sometimes it just doesn't come. So it's just, yeah, we have to push through. We have to do our part the best that we can so our coworkers don't suffer more or don't have to pick up our slack, because then it creates tension. And that's another thing that you see a lot in the meatpacking plants, is tension between coworkers, competition between coworkers. If you are really good at your job, at one job, you're not gonna get moved from there. You're gonna actually be requested in other lines to be going back and forth. So, I mean, being good at the job is kind of like a win and lose. It's like, okay, like I want to be good at my job, but if it's gonna be more exhausting physically and mentally, then I don't, you know? So,
Gabriela, could you share a little, I know you've been working with and talking with many of your friends and family who are still in the packing. You want to share some of that experience for you and what your role was in some of these actions we took?
Yeah, so I still have friends and people I consider like family in meatpacking plants. I have some in Guyman and here in Omaha. And like I said in my statement at the Capitol for the bill, our conversations completely changed from just saying hi and being happy to see each other to like just fear and the wonder and crying. I was like, I can't see you, I can't miss work, so how am I gonna pay my bills? And it's like it changed from the mood of happy to just depressed, anger, and sad. And I mean, that just takes an emotional toll on a human being. You know, when you want to go to work, when you want to provide for your family, but at what cost? And is that sickness is like gonna go now spread to your family because you want to provide for them? You know, it's like, so it's like, am I providing good things or a virus? You know, and it's like every day like the mentality of, well, this was mine, and a lot of my coworkers when we used to work together, is like, okay, if I miss one day, that's $100. Okay, so my check's gonna be short $100. That is a bill, or that is half a bill. So it's like, you cannot miss a day. And so it's like, from that experience and my conversations with my friends and ex-colleagues, I know what it's like being in there. I know that fear, and I know that penny pinching is like, that's why I knew I had to go and just speak up.
Thank you, Gabby. And I know it's really hard to share, so thank you for sharing with us. Dulce, would you like to share with us some of your experiences down in Crete with your family and you had a really remarkable activism down there, so.
Yeah, hi everyone. Thanks again, thanks Micky, and thank you everyone who helped put this panel together, this platform really to allow us to share our stories and really just have a conversation about workers and workers' rights. So I'll start out, I'll share a little bit about my family and our background. My family's relationship with the meatpacking industry, it really dates back a few decades. My parents immigrated to the US in the 90s. And we actually moved to Crete when I was about 2 years old from Grand Island, Nebraska, where my father was working at a meatpacking plant there. And then he later found a job more stable here in Crete at Smithfield. So he's been there ever since for about the last 25 years now. And my mother actually used to work at Smithfield as well when I was younger, and she had to stop working. She was injured. She injured her wrist and her arm, so she was fortunate to find some other opportunities within the school district, and she's remained there since. But you know, one of the things I like to share about us, so my siblings and I, you know, we're all we have sort of this complicated relationship emotionally, I guess, with the meatpacking industry, partly because that labor has really allowed my father to provide for our family over the years. But we think about at what cost, right? So his health, and he's developed some health conditions over the years as a result of his work at Smithfield. You know, the injuries that my mother sustained during her time there. So, you know, his work, his labor allowed him to put, you know, 2 of us through college and send his oldest son to the U.S. military. And so, you know, we're grateful for the opportunities that this job has provided for our family. but it's a little bit complicated. And so I think one of the things that you might see us do is, as an organization, Children of Smithfield, you might see us publicly shame the industry, the meatpacking plants, but you probably won't see us necessarily call for their abolition. And there are some food reform movements that do call for that. We've been asked, why don't you call for a boycott of the industry? Well, it's complicated, right? We want to make sure that what we're doing is the best for our parents, and is a decision that they would also make for themselves. So, there's really this interdependence between the companies and them relying on local, largely immigrant, refugee labor, and also the communities relying on the industry for a stable employment. And so all of that is valid and fair. But what we've sort of tried to advocate for since the beginning is just more humane and safer working conditions for our communities. And so I'll start sharing a little bit about Children of Smithfield and how we sort of started organizing and meeting and becoming really part of this larger movement back in April. So in mid-April, I would say, that was a time when, everyone was sort of starting to realize that COVID was here. It was now. It wasn't just an intangible idea at that point. It was local, and at some point it was going to affect us. And so the one thing that we realized hadn't really changed, and the stories that we were hearing from our parents, was that everything was just the same. Everything was just going on as usual inside the plants at a time where schools were closing, where public buildings were being closed off to the public. Inside the plants, things just kept going on as usual. And so, I always kind of describe it as being a time warp where, workers are very much an afterthought in terms of protections. So what we started to do was really started to expose what was going on inside the plant on our social media sites, sort of individually. We were sharing what we were hearing from our parents. And so we started to recognize amongst each other, who we were, saying, oh, this person is upset about this issue too, and that person is upset too, what can we do as a group? And so we started connecting and having these conversations about what can we do together to help voice our parents' concerns, largely because of the fear that they had for retaliation, right? I think anytime that they speak out or, speak out against the industry, there's always this very real fear that their job is on the line. And so in a way we had to be their voice in a sense. Not that they didn't have a voice, just that it was silenced. So, as children of immigrants largely, our parents always expect more and want more for us, right? That's part of the reason that they immigrated to this country, wanting more for their children. But at the same time, I think as we grow older, we also expect more for them, and we believe that they deserve more as well. So I think that was sort of at the core of our actions. I actually remember my first conversation with Micky on the phone back in April, and basically, just laying it out there and saying, hey, this is the situation. I don't know where to go from here. We're all concerned. What should we do? And, as I mentioned, we didn't want to do anything that could be more harmful than it would be helpful for our parents. And I think the best piece of advice that Micky really gave me was, the worst thing you can do is do nothing. And so we took that to heart. And our first action was really to start bringing awareness to the issue, raising public consciousness. We called up a local media outlet and sort of pitched the story, described this was the same plant that in Sioux Falls, South Dakota, that had the largest outbreak in the nation at the time. This was the same plant that was here in town. So we asked if they'd be willing to come down and do a story, and we actually convinced our parents to speak out and speak in their own words, what was happening, anonymously, of course, but they trusted us they trusted us in doing that. So that sort of snowballed after that. We started getting some more national media coverage in coordination, of course, with the other members of the coalition. And then we sort of started shifting gears. We started moving towards more direct action. So organizations like Solidarity with Packing Plant Workers, that was a group that was having drive-by vigils in Lexington and Grand Island. And then they invited us to do the same here in Crete. So we organized a vigil out at Smithfield where we had the socially distanced protest. It was more, at the time we described it more of an event in support of workers. So as workers were leaving, when they were leaving their shift, we drove by and we would wave and honk and sort of show our support for them. But really what we were doing is demanding that companies provided their workers adequate PPE, paid sick leave, hazard pay, testing, and contact tracing as well, because Smithfield really wasn't conducting many of those practices, and if they were, they weren't conducting them very well. So we were demanding more. And then in coordination with the larger coalition, we started, as Micky mentioned, gearing towards public policy and working on, meeting with the governor, meeting with our state senators, our US senators, and really laying out the problem and having them hear from communities directly so that they could take action on the issue. I want to share a story about, COVID-19, the inequalities and the, injustices within the meatpacking industry towards workers. They've always existed. It's always been gruesome, tiresome work. But just, this pandemic has really sort of exacerbated those inequalities. Worker injuries have always been high, line speeds. It's always been an issue. They're too fast. And often when the line speeds, and when I talk to my dad about line speeds and how that actually, works out and plays out, OSHA is allowed to come in and inspect the plants, but often when they come in, they call the company the day before. They give them a little bit of notice and let them know that they'll be showing up, right? So that gives the company a little bit of time to clean things up and make it nice and slow down the speeds, so that it's acceptable, right, for an inspection. When in reality, things day to day look very different. So just a quick story about one of my neighbors, actually. She's about 62 years old. She's been working at Smithfield for many, many years, probably decades. She actually had an accident a few months ago. She had a double accident. It was an injury to her arm, her hand, and her leg. So she was actually out for a while. What happened was, I think a large machine fell on her hand, and so that really took a toll on what she was able to do. So she was out for a few months. And so this was prior to COVID, but because then COVID came along, her leave was extended because she was older than 60 years old. And so she was allowed to be out for a little bit longer. So this is a woman who's really nearing retirement. So she was asked to return to work just about a week or two ago. And so her first day back, right after being out for about 6-7 months, and they are expecting her to work 10-hour shifts. And so, as I said, her age, her conditions, all of these things that are really affecting her ability to work at this point, and really just the expectation, again, prioritizing the product over the worker and their health and safety. So she's still having to fight that. So that's all just sort of to mention, that these injustices are still happening, that they're being sort of complicated a little bit more because of COVID. So I think as we move forward, yes, basic protections, those are still needed. We have a long road ahead. However, in order to achieve those humane working conditions for workers, you know, we need changes probably at the federal level in regards to line speeds and putting some limits on that. We want more plants to be able to gain union representation in Nebraska and really across the nation. And even more importantly, more oversight of the industry, right? The agencies that are really supposed to protect these workers, like OSHA, we need them to utilize their power and to exert their power in a meaningful way, as it's intended to do. You know, this administration has really weakened a lot of those existing protections that did exist in the past in regards to especially line speeds, and it's continuing to weaken a lot of those protections. So we need accountability. You know, at the beginning, I think we thought that the industry, just like anyone, was unprepared because they didn't know that something like COVID could happen. But we've learned that the industry actually dismissed years of warnings that something like COVID could happen and that it could totally ravage the health of workers. So, you know, they were intentionally reactive in their approach and in protecting workers. They chose not to be prepared. And that's something that demands accountability. So as we move forward, you know, we invite people to reach out if you want to be involved, if you want to do something about this. You can reach out to your public officials. You know, the governor can still act at any time. The legislature will reconvene in January, and you know, Senator Vargas has really been leading this effort amongst his colleagues. But, you know, you can call your elected officials and tell them you're worried, or, you know, you want to see them work on the issue a little bit more. Lastly, if you're eligible to vote, you know, really try to vote for candidates who are going to represent the working class, who are going to represent meatpacking workers and communities of color, people who are not usually represented and their needs aren't usually voiced, and really people who will value people, right, over profit, and who will keep that at the core of what they do. One more thing, if you just want to stay up to date and informed, you can follow us on Facebook or Twitter. We're at Children of Smithfield on Facebook or Smithfield Child on Twitter. But there's other great organizations, as you see here, Heartland Workers Center, the Refugee Empowerment Center. They all do really great work. So you can follow them as well on social media. But overall, you know, thank you for tuning into this panel. I hope this gives you a little bit of perspective on the role that meatpacking plants really play for immigrant families, and the ways sort of in which these very international corporations, the way that they're so deeply intertwined with our rural communities, but also with our families and ultimately with our dreams. So thank you.
Thank you so much, Dulce. And now we're going to hear from Alana Schriver. She's with the Refugee Empowerment Center. She was a testifier on the bill we mentioned, and she works with the refugee community here, and they've been deeply impacted. So, Alana?
Yeah, hi. We also at the Refugee Empowerment Center do overlap with the Latino community when people's status falls under the Office of Refugee Resettlement. So we directly resettle refugees from Cuba and El Salvador. And then if someone has asylum status or victim of human trafficking, we can also support them through our organization as well. The bulk of our clients do come from Asia, the Middle East, and Africa, though, but the vast majority end up getting their first jobs in the food processing industry. And just on a personal note, I grew up on a cattle farm, and, you know, just as a Nebraskan, our entire state's economy is dependent on protecting these workers and keeping these workers healthy and safe. If we don't protect these workers, you're putting the whole state's economy at risk, not just their families, but all the farmers and everything else that's dependent on what happens in these processing plants. Personally, my role at Refugee Empowerment Center has had 2 direct COVID-19 food processing responsibilities. One, we were granted a bit of money from the Office of Refugee Resettlement to provide financial support to people who have lost income due to the pandemic. And what we typically saw from applicants for that assistance is that they contracted the virus at work and took their time off so that they could quarantine and get healthy, and they weren't paid for that time off. And in a lot of instances, not only were they not paid, but they lost their job as a result, because a lot of these facilities are on a point system. So if you rack up so many points in a certain amount of days, you lose your job. So if you clock in late, that's a point. If you miss a day of work, that's a point. And if you get 3 points in 90 days, you're fired. And so we were finding people who took the 10 days, 14 days recommended by their doctor, and then they lost their job and they couldn't even file for unemployment because their employer is saying, well, you chose not to come into work and you knew that that would result in you losing your job. Or not only would they not be paid when they stayed home sick, but a lot of plants were offering bonuses, essentially bribing people not to miss work, to come in sick. And so people were trying to take ibuprofen in the morning and hide the fact that they were sick and go into work and do those things. And then one other responsibility I have during the pandemic is to help people cover their funeral expenses. And to date, I've helped with 24 funerals. Every single funeral I've assisted on has been the family member who lived with someone who worked in the plant. So the worker got sick and brought it home to grandma or their parent or their elderly aunt or uncle, and then that person passed away. And like you mentioned at the beginning, Micky, those numbers aren't being credited to food processing plants as the cause, even though that's very much the reality. And like Gabriela said, all this guilt you have as the one going into work and not knowing what you're bringing home to your family members. We have clients that have told me, I'd rather go back to Burma and fight the army because at least I can see them and I know what I'm fighting. When it's a virus, you can't see it and you don't know when you've been exposed, and you don't know when you're in danger, and you don't know when you're putting your loved ones in danger. And it's just such a huge pressure on people to have to decide, do I pay my bills or what am I supposed to do as a worker in that position? So Refugee Empowerment Center is working on advocacy issues at both the city and state level. Since we didn't have success in the legislature in 2020, now our efforts are focusing on trying to get the city to enact a city ordinance requiring paid sick leave. At the very least, we're trying to get paid sick leave for people. And we have a survey for both workers and plant managers to take, that we share the results publicly on our website, so that, let's say a plant says they have all these protections in place and that's what they're stating publicly. But if the worker who's actually there says differently, then the public has a right to know that. And workers have a right to know which plants are valuing their lives and their health and their safety and which ones aren't, so that they can make these educated choices about where they want to work based on who values the workers themselves. So yeah, that's where we come in.
Thank you so much, Alana. So I wanted to just, this theme of the product being more valuable than the workers has come up several times in this. And one thing I wanted to just briefly mention is that we've talked about line speeds. The USDA actually is the only entity that regulates line speed. So there aren't any ergonomic or safety related restrictions on line speeds. Again, the USDA regulates it because if it gets too fast, the meat becomes unsafe. So you can see that really even in that, the priority continues to be quality of the meat, the safety of the meat, and not the safety of the people who are producing the meat. I wanted to just ask some of our panelists briefly, like what do you think that isn't a protection that we've heard come up over and over. What is maybe the top line thing that you think if people could focus on changing one thing about the situation could really help from a citizen advocate perspective? What's one of the things that you've seen having the biggest impact on this, and what could really help the most? Sorry, I have to call on someone. I'd love to hear from you, Gabriela, since you've been in these working conditions. What are the things that really could make the biggest difference?
I would like to say line speed, but I think one of the main things I would like to see from the meatpacking plant companies overall that would help make better changes is the transparency that it has with their employees, but also with the public and agencies that are supposed to regulate this. I feel like if there's transparency between all of them, it would help reevaluate where is it wrong, such as line speed, such as basically the lie of making everything look pretty for an hour, and then until inspectors leave, everything goes back to normal. So I mean, it goes transparency because that just overarches everything, but it's just line speed. If they would regulate that, it would just create better environments. And I mean, if we want to put it in that point of the product is very important, which it is, if the line speed gets regulated, the product gets done better, gets cut better. We have more time to spend on one product or one piece of meat, then therefore it'll come out better. So therefore the employee, the customer will be happy. Then the worker working on that piece of meat will not be in pain, will have, more better, will just be off better working with their meat, with the product that they have to turn in. But I think the priority is the transparency that there is not right now with the companies and the employees, the workers, and the agencies that are supposed to regulate.
That's an excellent point, and that I would like to kick it over to Dulce, because I know that one of your big early issues was transparency and testing. Can you talk a little bit about that, and maybe sort of what you were looking for and what you were able to get the company to do with public?
Yeah, so one of the things we noticed was that the company was really telling workers if they did get tested for COVID not to share their results with anyone, regardless if it was their coworker immediately next to them or a family member, or they just said don't share with anyone except for us. Tell HR. But then HR wasn't doing anything with that information. They weren't doing contact tracing at that point. So that they were asking for the information, but they weren't doing anything responsible, you could say, with it. So the workers were really having to do their own contact tracing, and so a little bit defying what they were told by HR. But in order to keep their coworkers safe, they did their best to let their coworkers know, hey, I did test positive. You should go get tested as well, or you should stay home. So I think that was one of the biggest things that we were asking for in terms of transparency and contact tracing there.
Thank you. And I see a question in the chat that I'm gonna ask Alana to tackle. I think you have a unique perspective as sort of daughter of impacted families here. You certainly, someone is asking what incentives are there for the plants and the business friendly side of this to care about workers in this. And you have a family who's involved in meat production. And so I think, what do you think?
Yeah, this is what Nebraska is as a state. We're an agriculture state, and the vast majority of the people that live here work in agriculture in some capacity, whether they're growing the food or raising the livestock or processing it or shipping it or selling it. And any break in that line crashes the whole system. And I know for my own dad, you know, when you raise a calf from birth, like, he's too big of a softie. He would never, he couldn't do the next part of it for $1 million. He just couldn't do it. And so every single person in that process is critical to the process. And if you don't protect the essential workers, I mean, that's what the word essential is, that they're not disposable, they're not expendable, they're essential, absolutely essential to the core of Nebraska's entire economy. And so you're not just protecting these individuals by putting sensible safety precautions in place, you're literally keeping the state of Nebraska afloat, and protecting everyone's culture, everyone's way of life. And you know, even for people who aren't attached to the agriculture industry, you don't want to go to the grocery store and pay $30, you know, for beef or whatever. It's in everyone's best interest. And I think Gabriela is exactly right. In general, slowing the line speeds down, even when there's not a pandemic, is common sense. And I think some earlier points that Dulce made about fear of retaliation, when you know that your workers have faced very real persecution in their lives and have lived experience where they have been retaliated against by the person in authority, they're preying on that. They're preying on that fear. They're counting on it. They're counting on people not knowing their rights, not you know, self-advocating. And so it's absolutely critical that education is provided, that people know what their rights are, that support is in place to help people advocate for themselves and to advocate for what's right. I mean, even if you're not attached to it, your kids go to school with the workers' kids. We're all going to the same places and go, you know, it's not like the virus is just going to stay in the plants or stay in those homes. It's going to go everywhere that people go. And the whole like us versus them mentality that's so pervasive in the United States right now is not helpful, and it's not right. And it just, 2 seconds of thinking, you'll realize we're all on the same team. And I don't know, it's what should be done. For me, I think especially letting people know that their job is secure. I think in any industry, you should never lose your job just because you get sick or you've been exposed to a virus. I think the plants who have chosen to inform their workers and not only let the people who test positive take those 2 weeks, but let the people who've been exposed take those 2 weeks, the reality is they're not seeing ongoing infection. They're not seeing ongoing spread. Once they started to allow that 2-week quarantine for both the positive worker and the people they exposed, they're not seeing any more cases in their plants.
Right, and I think there's another aspect of that question that I want to circle back to, because there's a perception in the worker. There's a perception, it was voiced in that question, that these are easily replaceable workers. And I think that goes to two things: the perception that this is very easy, unskilled, replaceable work. And it also goes to a perception, or it also goes to workers' perception of themselves as being easily replaceable, and therefore the retaliation on being unable to speak up. Because if you're easily replaceable, you don't have any power in the situation. And so I want to just kick over to Gabriela a quick question about that. The skill level that's required, how long did it take you to really be skilled at what you were doing? I know you worked on the ham line, and you were very proud that you worked on the ham line. Can you share?
Yes, so I worked in the Diamond plant. It was pork. So I worked in this area called ham. And it was just breaking down all the pieces that you consider ham, I think. I don't know. But it was just the ham area. I was very, very proud of my developed skills. It took me forever, maybe a year or more to get to where I was. But it wasn't just me, it was a lady that I had working next to me that she really took me under her wing and taught me how to make sure my knife stays sharp, how to work faster, how to get the right cuts faster, because I would just go in there and chop everything and then I would get in trouble. So it took me about a year to get good in one knife. And then I had to learn the electric knife, and that is just more training, which took me about a few months. And then I learned a circle knife, which is called a wizard. And that's mainly used to clean out bones. That one is really hard because you have to have it at the right angle. If not, it goes flying off, which did happen a couple of times to some of my neighbor coworkers. But it takes months to learn how to angle it right, how to sharpen it. So I think by the time I left the pork meat packing plant, I was still learning how to get the right angles on some knives and the speed. You have to not just know the angles, but your hand has to cut fast, like super fast. Like you cannot just be like slow. It has to be like next. And it took a long time. But yeah, I think my proudest one was working in the pork plant. That was good.
If you don't mind, I'll jump on. I think a lot of times when someone hasn't done a job before, they assume it's easier than it really is. Even with interpreting, everybody thinks, oh, well, they're bilingual, they can be an interpreter. But you have to be good at it. You have to develop that skill. It's absolutely not easy.
There was definitely days where I cried. The first day that they put me on the long knife, which I had to work hard. That was the fastest that I had to cut. The first day, my sisters worked in the night shift. I worked in the morning shift, and I saw them coming on the floor, and I just went to them and started crying. I'm just like, I can't do this. This is hard. I'm not this fast. I'm not gonna get good. And then like once you get thrown in the, not thrown, but put on the floor to do the job full time, trainers, they have a lot of people to go help. So it's like you kind of get left behind. So it's like I'm trying to figure out and not get my coworkers to be mad that I'm slow. But yeah, there was definitely a lot of days that I cried.
Yeah, it's certainly, I mean, there's the perception of skilled and unskilled. And there's also, I think, I'll just add to this that the view that workers are replaceable is very, very convenient for employers to promote, because people feel like they can't speak up if they feel like they can be replaced. But the Crete plant, correct me please if I'm wrong, Dulce, but their workers walked off the job for, what was it, 2 hours before management started to take it pretty seriously. The reality is that workers you cannot run these plants without workers, and it's convenient to let them think that they can be replaced, but the reality is very different. Dulce, I noticed you unmuted.
Yeah, so that was particularly after it got to a point where there were already dozens of cases, positive COVID-19 cases within the plant amongst their workers. And so they announced that they were going to shut down the plant for 2 weeks. And so I think that relieved a lot of workers from the stress that they were feeling at the time. And then they reversed course and immediately issued another statement saying that they were not going to close. And so at that point, I think workers felt that their lives were being toyed with, and that they weren't being taken seriously, and that their health wasn't taken seriously. So they decided to walk off for for a while, and then management came in and spoke to them. And I guess one thing I want to add in terms of the skilled and unskilled, I think in conversations I have with my dad, you know, he's been doing his job for 25 years in different departments. But one thing that he says is, I can do this job with my eyes closed. Not that he does, but you know, it's just how many years it has taken him to perfect the job and to not get injured, to do it at the right speed, to be able to now, you know, teach his coworkers or new workers that are coming in. You know, that takes a lot of time to develop, as Gabriela mentioned. Yeah.
I think language also allows the plant managers to exert control over workers, and they have an excuse of, well, if as a plant manager you don't provide an outlet for people to submit complaints or questions or whatever in a language they're fluent in, or in a method that makes sense, like we're doing an online survey. Obviously not everybody's going to be able to do an online survey, so we're calling people or we're doing home visits to fill that out. But when you don't make that effort as the management or the owner to provide communication in a language people understand and feel comfortable expressing themselves in, then you can say, well, nobody said anything, nobody's complaining, everything must be fine. And really they're making no effort to ensure everything is fine.
If I can add to what she just said about nobody making complaints, I think that goes back into also why we're not hearing a lot of reports from for COVID from the meatpacking plant workers themselves. Is because they don't know what's going on, because everything's so hush hush. It's like, okay, like there's nothing here, obviously. There's nobody saying anything about, hey, they feel sick, but there goes back to that fear of retaliation, fear of saying, hey, I'm sick, fear of missing one day of work. So it's like, you'd rather stay quiet than get in trouble and miss work and not get paid. So it's like, it all goes back into, like, as Elena said, hey, like, you need to feel supported in any work that we do. Is feeling supported that you are a valuable person and a piece of this industry.
That is a perfect segue to my final question for the panel. I'm going to ask all of you to answer in turn to wrap this up. And first I'll just answer, there's a question in the chat about communicating with top-level management and executives. So I just want to share really quickly that early on in our efforts, we did draft a best practices letter based on all of our research and all of our work with the workers and unions. And we tried to bring it to meatpacking owners to say, these are some of the best practices. And then we put that into an op-ed to employ, you know, to publicize it more widely, to say, hey, please check out this letter. These are the things that could really make a difference in your working conditions for your employees. And this is why it matters. And if these things don't get fixed, we're looking at shutdowns. The science is saying we're going to be hitting critical shutdowns. And we did. Not a single employer reached back to us to talk about that. So we did make those efforts is the short answer. So my last question for all of you, and we'll go in the order we starting with Gabriela, is how can the people in this panel presentation that want to get involved, how can they make workers feel supported? And get
I think there's a lot of ways. This is, I mean, seeing we had 46 participants earlier. That is, as a former employee, that's awesome. Like, there's a lot of people that want to learn, that there's an effort that's like, okay, what's going on in there? But also just, I think, do research as to what the meatpacking plant is and the types of works. There's a lot of different types of works in there. But also make a call to your representative. Be like, hey, have you looked into better safety precautions? Also call the agencies that are supposed to regulate this. Like, hey, you know, COVID's going on, how are these types of jobs looking, or request an inspection. Or also check on the people that you know, on everybody. It's like, hey, let's just ask questions like, how are we moving in today? Like, how are the meatpacking plant? How is this job? Or whatever work you do, is just check in on people you know. But also, I think when you can, be a part of the advocate team and use your voice, that we love to hear different voices, to advocate for change, to just be like, hey, this could be regulated a little bit better. We're just asking for better safety precautions in the workplace. And I think, just as a former employee, just remember, these are human beings. Simple as that. We're human beings that want to go home safe.
Dulce?
Yeah, thank you. Those are all really great points, Gabriela. I think just to add to that, you know, this is a community issue. I think that's something that we've, you know, tried to really make some noise around since the beginning, is that this doesn't just affect workers, it affects their families, which affects their neighbors, which affects entire communities. So, you know, one thing you can do is do your part, you know, wear your mask, try to social distance. You know, I know we're living in a time where this is perhaps exhausting now, but just continuing to keep yourself safe and try to keep the people around you safe, out of respect, right, for yourself, your family, and your neighbors as well. I may be preaching to the crowd, but I'm just remembering that.
And I would say, in addition to pounding your state legislature and representatives, don't let the city off the hook either. You know, if go to your town mayor, go to your county commission, go to your city council, just make yourself a thorn in their side and make them pay attention to this issue. And whenever possible, whenever I'm trying to convince someone that doesn't agree with me, I always try to start with what we do agree on and start with what I know is important to that person. So if I know this certain thing is important to Mayor Jean Stother, then I use that as my stepping off point to make my next, to push for what I want and to push for, you know, what's important to me. Rather than just like coming in as like a, you know, you always try to start on the same team, even when you might not feel like you're on their team to begin with, is really helpful. And no matter what your job is, you know, if you're a teacher, you've probably got kids of food processing plant workers in school. So just check in with them and see how they're doing and see if they need anything and see if they have ideas for what they want to happen at a city or state level as far as protections or ordinances go. Provide that education to people. Let people know that they have rights. Post on social media about worker rights and, you know, just in general, what are your rights in the United States as a worker? Every single day, 7 days a week, 3 times a day, there's shift change. So 2,000 people in some instances are going in and out of the same door 3 times a day. You know, you could translate information about workers' rights. You could be in the parking lot. You could meet people where they're already at and provide that information and provide that support and be like, here's your rights and I'm here to fight with you for those rights. You're not on your own in this fight, you know, and if you have people in your social sphere who have, you know, networking opportunities or whatever, make sure that to involve those power players in your own lives. Like maybe someone on the board of the organization you work for is good friends with someone in power or whatever, you know. It's like AOC says with voting, if you can just change one person's vote, you've made a big difference. So, you know, vote for the people that care about workers, support those elected officials that care about workers, and then do your best to change the mind of the people who haven't related it to themselves personally yet, who may not see their own personal connection to the issue, educate those people as well.
I just want to close by thanking everyone. Those are all phenomenal ideas. And I want to thank you three particularly for being women who consistently exercise and employ all of those strategies. We need more advocates in this world, and you all are invited to be part of this conversation. And the election is coming up, so go look, see who voted for these protections. There are people on the ballot who were fighters for this issue. There are people on the ballot who were not. And so know what people stand for and exercise your voice. So with that, I'll kick it back to Barbara to bring it home.
So thank you so much to the entire panel. I want to thank our audience members also who have enthusiastically stayed on, and that was really cool that Gabriela noticed how many people we had out there. It was a great day. Thanks to Micky, who not only did a fabulous job of moderating, but she helped to set up almost every aspect of this. It's really great to have good community collaborators. And for Gabriela, Dulce, and Alana, your time away from the responsibilities that you have was so significant to bring in powerful personal experiences and from all different aspects of this topic. So thank you very, very much. And Jason Lyons, who's our technology expert, we thank him for being there and helping us with all of the points. He's going to put up a couple of slides as we finish here. That's a reminder that we have an online evaluation at mccneb.edu/IIE-EVAL. Completing that, you do not have to include your name and contact, but if you want to be counted as an attendee who might be recognized in the future, please do add it. And then our final slide will share with you the very next virtual program that our office is sponsoring at the end of the month, October 27th, from 10 to 11 a.m. We will be celebrating another one of the books in our 13th annual Diversity Matters book series, White Fragility, Why It's So Hard for White People to Talk About Racism, authored by Robin DiAngelo. We're excited that discussion leader Ben Wells Friedman, PhD from St. Mary's University in Minnesota, will be with us virtually to take apart that book and see what we think about it. For those of you who plan to join, you can either find your own way to get a copy online. If you are a Metro student or personnel, you can contact Metro Libraries, and if they still have copies available, they will mail one to you. And I can tell you that regardless of the number of people involved, we will be breaking down into breakout rooms so that everybody has a chance to share their thoughts. So that's how we will end our presentation today. Thank you again, panelists. We had a wonderful time today, and thanks everybody for your continued participation and concern about important issues in our community.